Well, in many ways, we've gotten better at handling infectious diseases, but they still remain a threat. So we do have antiviral therapies. We've got a whole slew of vaccines. We've got much better sanitation, much better understanding of the transmission of infectious diseases. Back in 1918, they didn't even know that flu was caused by a virus. So all of that is going for us. We've got sophisticated critical care in hospitals where you can get mechanical ventilators, oxygen therapy. All of that type of stuff is very new, and it makes us much more resilient against infectious diseases. But they still remain a threat because we've seen that there are lots of mysteries there. We have an HIV pandemic that's ongoing right now. We've got hepatitis C cases that are out of control, kind of fueled by the injection drug use rise in the United States. We have bird flu viruses that are a subtype of flu viruses that are very lethal, that are hard to control, and we don't have good vaccines for. We have a whole host of things that kind of come out of nowhere, what we call emerging infectious diseases, for which we don't have vaccines or antivirals for. So, and then we have antimicrobial resistance, so bacteria that become resistant to antibiotics that also pose a major threat. So there are definitely threats. I think the threat is much less than it was in the earlier time of our species, but it still exists. And in many ways, there are certain factors that might make it easier. So if you think about megacities and the population of the world, how easy it is to travel from one side of the globe to the other. Before, an infection spread at the speed of a boat, maybe. But now an infection spreads at the speed of a jet. So you can be from one side of the world to the other side of the world very, very quickly. And what's happening in Africa can be in Los Angeles in a day. So it's not something that you can take lightly, the ability of humans to travel around the world very quickly, and what that means for infectious diseases and disease importations and exportations.
So what can the general population be doing on a daily basis to help prevent spreading or even catching infectious diseases?
I think the number one thing that the general public can do is be vaccinated against what the known threats are. And then the other is to be on the lookout for odd things that happen and be mindful when you're doing things that put you at risk for getting kind of an emerging infectious disease. So if you are somebody that goes spelunking in caves and around bats, for example, or if you're somebody who works on a farm, or if you're somebody who works in a slaughterhouse or does things that expose them to other pathogens, it's important to know that and tell your doctors when you get sick, hey, I work and I do this, because many times they don't do that. They forget, they don't think it's relevant to even tell people that they've traveled somewhere where there might have been an infection. And I think that's something that people can do on a day-to-day basis that will make us a little bit better. It's not going to completely do it because it's kind of part of the human condition that we're going to be bombarded by infectious threats, because you have to remember that if you look at this planet from a biomass perspective, like the things that are alive on this planet, most of it is microorganisms. Just a small sliver of that are animals, and a small sliver of that are humans. So this planet is dominated by bacteria and viruses and lots of other things, fungi. If you look even in this room, there's people in this room, but we're dwarfed by the number of bacteria that are in this room.
Yeah, you said look out for things that are odd.
Yeah, so if people have unexplained illnesses, that type of thing, don't let these things linger. Don't wait 5 days to come into the hospital, and be kind of proactive about your own health. I think that's one way to do it, but it's going to be very hard to do that for the general public, because they're not going to know what's odd. But in general, when you look at cases that get missed, there often are warning signals or something that was off that people were ignoring or not quite taking into full consideration.
Mm-hmm. Hey everyone, thanks so much for watching the episode. If you're interested in contributing to the conversation and supporting the show, there's 2 easy things you can do. 1, click subscribe, and 2, visit our Patreon page where you get exclusive access to the Exploring Minds community.